So today we're going to be talking about rib raising. There are a couple indications of why we might want to rib raise in the first place. So if the patient were to be presenting with indications of lymphatic fluid sitting on the lungs, or trouble breathing as a result of COPD or other related conditions, something like rib raising can be very effective in relieving those symptoms and promoting better breathing going forward. So as we know, we have parasympathetic and sympathetic nervous systems which run throughout the midline of the body. We have parasympathetic, which sit cranially and sacrally, and sympathetic nervous system, which sits in the middle between about T1 and L2, give or take a vertebrae. So by doing rib raising, we can affect the sympathetic chain which runs in the thoracic spine, and either upregulate it or downregulate it depending on what we're trying to do. So if a patient were to present with something like lymphatic fluid sitting on the lungs as a result of a hypersympathetic condition, which is the most common form, we can inhibit the sympathetic nervous system via a stretch and hold type of technique to decrease our hypersympathetic activity, which could be promoting lymph to stay on the lungs. So initially, a good place to start is usually by Chapman point examination. So we have pulmonary Chapman points, which exist between the second, third, and fourth intercostal spaces. If these points are positive for a potential dysfunction, they could be hard tapioca pearl-like consistency, or potentially the muscle will be spasming or just overall more tense than the surrounding tissue. So by examining Chapman points 2, 3, 4 are Chapman points between the second, third, and fourth intercostal spaces, so we give our clavicle and move down to the first rib on either side of the sternum, and then to the third intercostal space, and then to the fourth intercostal space. I'm not feeling any tapioca pearl-like consistency there because she is healthy. However, that would be a good place to look for. And then if we were to treat via a Chapman point analysis, then we move to the posterior side and work from there. But today we're focusing on ribbing. So having her switch positions and lay on her side, we can get a feel for where our segments are located. So at the spine of the scapula, we have T3. So for the lungs, we'll be looking between T3 and T2 through T7. So I'm going to get on the spinous process of T2, which will be parallel with the lamina of T2, and get my fingers on her costotransverse angle right there, or costovertebral angle right there, and then using the spine of her scapula, the angle of her scapula, we'll move to T7, which is the perfect location. Now I'll have you slide back. Great. So now my fingers are on her costovertebral prominences of T through T7, and to decrease hypersympathetic activity, I'm going to pull and hold on this location on her spine. And by pulling and holding and inhibiting the sympathetic activity, or the hypersympathetic activity, is usually most effective in decreasing lymph fluid that's sitting in the lungs. Now, if there was an indication for stimulating the sympathetic activity in this area, a more rhythmic pumping motion utilizing the fulcrum of the table can be effective. So now after doing that, and then initially repeating it on the other side of her body, we can achieve our desired result of either rhythmic pumping, stimulating the sympathetic chain in that area, or stretch and hold type of maneuver, where we would be inhibiting the sympathetic activity in that area. And depending on which segment we are focusing on, for T2 through T7, we can be acting directly on the dermatomas of what innervates the lungs in that area. I hope this was informative, and thank you.
Okay. So today we're going to be talking about what we can do to provide some patients some relief if they come in with some otitis media or some sinusitis. Specifically, we're going to be ending with the Galbraith technique or the jaw lift. So first thing you want to do is think about the lymphatic system and how that fluid can kind of get obstructed of flow and cause some tightness, fullness throughout the sinuses, the jaw, the neck. So first what we want to do is kind of release the myofascial, or do some myofascial release in the thoracic inlet. And so what we're going to do is find the anterior border of the trapezius muscle and the posterior of the clavicle, and we're just going to feel for some tension and see which way we have the most tension. And what we can do is take this arm out, abduct it a little bit, and kind of feel for some tension in there, and hold it for 20 to 60 seconds, just where you feel the tension, and kind of open that up a little bit. And once we do that, we can just continue on with getting that lymphatic fluid flowing, and we can do some cervical chain drainage. So if you can turn your head this way for me, and what we'll do is right through here, we'll just keep moving that fluid just so that it can start draining so it's not so full through here. And we can even do some auricle drainage like this, and we could even do some suboccipital release just to get all that lymphatic fluid moving. But the technique in specific I want to talk about is the Galbraith technique. So we're going to have the patient turn their head towards me, and we're going to feel for the angle of the mandible right here. Now I want my patient to just open their mouth, just relax your face. And I'm going to feel for this angle of the mandible, and I'm going to steady my superior hand on their forehead. And then I'm just going to do some rhythmic pumping motion and bring that fascia right there anteriorly and medially. And what we're thinking about when we're doing this is getting all this fluid from the eustachian tubes to just gently release. And what I can do is do this on each side, and we can do about 30 seconds on each side up to 3 times a day. And hopefully that'll get all of this fluid running down to our thoracic inlet so we don't have such an obstruction of fullness and tightness. We can also go to do some sinus effleurage and open up these spaces in here, move the fluid throughout. So we want to make sure that before we do this technique, we're opening up these pathways to get the fluid running down.